Hello! Today I will be talking about Lyme disease. Living here in the Northeast, I know we have all heard about it by now, at least once. It's very common here, but not many really know about the disease. So during this presentation, I will inform you about what the disease is, how it can be transmitted, and what the signs and symptoms are, and I'll also give you a small history of it and the treatment and prognosis. Hopefully, at the end, we will all have taken away vital information to keep with us. Etiology: cause or origin of the disease. Lyme disease in Connecticut was first founded in 1975. According to the Connecticut Department of Public Health website, there was a group of kids and adults that actually lived in Lyme, Connecticut, who all shared similar arthritic symptoms. And 2 years later, the first 51 cases were described, and those little black-legged ticks seemed to be the link of transmission. In 1982, the first brochure about Lyme disease was produced by the Arthritic Foundation. This was to try and inform the general public of the upcoming disease and what they should look out for. 2 years later, in 1984, serology testing became available. Serology testing is a test that looks for specific antibodies in the blood, and according to the CDC website, in 1987, Lyme disease became a legitimate disease to report. In 1982, Borrelia burgdorferi was founded to be the bacteria that caused the Lyme disease. I was looking into a National Library of Medicine, and I seen that Borrelia burgdorferi is a gram-negative spirocate bacterium. As I mentioned in my other slide, Lyme disease is transmitted by the black-legged tick. They are very small, and the adults are only about the size of a sesame seed and can be very easily missed. However, humans aren't infected by the adults. It's the nymphs that are more likely to transmit the disease. And because they are only half the size of the adult, they're very hard to see. After researching on the CDC website and experiencing ticks and their bite firsthand, I have found that ticks can and will attach to any part of the human body, but they tend to look for dark, warm areas such as armpits, groins, and behind the ears, and the scalp, of course, which in most cases make them very hard to find and remove. It only takes about 36 to 48 hours for an attached tick to transfer its bacteria, so finding them quickly is key. Signs and symptoms. How do you know if you could have Lyme's? Well, one big sign is if you have found an attached tick on you. According to the National Library of Medicine, 70 to 80% of cases first show signs of a rash and a target shape around the bite location. Someone who has been infected could develop migraines, fever, and flu-like symptoms. Some cases, neurological abnormalities and cardiac issues can occur. If you experience any of these, seek medical professional help immediately. Diagnosis. The National Center for Biotechnology Information, or the NCBI, state that arrhythmia migraines histologic findings are nonspecific. Rarely, mast cells and neutrophils are identified. A biopsy may show eosinophilic infiltrates, which consist of a reaction to the bite. Spirochetes may be identified using antibody-labeled or silver stains. Usually, a paucity of spirochetes is found in the tissues of those infected. So clearly nobody really wants to get bit by one of these. That doesn't seem too fun. So I'm going to talk a little bit about preventing that. And according to the Medical University of Bialystok, you can prevent getting this disease by simply avoiding ticks. When thinking about going outside, think of the location. Ticks love long grassy areas or thick brush. And if you see that, stay away. If you see the trail is clear, then just try using a good anti-tick repellent. This will deter the ticks and make them not want to bite you. Another thing to remember is ticks are attracted to warmth. If you brush against a tick and your skin is exposed to them, then they'll be more likely to latch on. A good way to also protect yourself from ticks is to cover up. Wearing the appropriate clothing will help prevent exposure. Wearing long sleeves, long pants, and tall socks will significantly improve your chances of not getting bit. Now, don't panic. If you find yourself in a situation where your doctor diagnosed you with Lyme disease, first thing to do is to obtain first-line antibiotics like doxycycline, amoxicillin, penicillin G, and a few others. You will probably feel a little icky for a few days depending on the severity of the progression of the disease, but as long as the tick is removed and you start and finish the antibiotics, then you should recover relatively quickly. As stated on the NCBI webpage, claims most cases of Lyme disease is usually curative. However, this sometimes is not the case. During treatment, there can be complications like late diagnosis, antibiotic treatment failure, and immune suppression. And in those cases, some symptoms can last anywhere from six or more months. You may need regular doctor visits to try and suppress the disease. About 5% of patients will have symptoms that will stick around, such as fatigue, pain, or joint and muscle aches. If it becomes chronic Lyme disease, the disease normally gets treated like fibromyalgia or chronic fatigue syndrome. The idea of chronic Lyme disease is still debatable. In most cases, someone who has chronic Lyme disease can't show positive workup, and there is no evidence showing that long-term antibiotics helps. Most eventually recover without any residual side effects. In the United States, confirmed cases of Lyme disease is reported to the CDC by doctors or laboratories whose patients contract the disease. According to the CDC website, each year, approximately 30,000 cases are reported to the CDC by state health departments and District of Columbia. Standard national surveillance is one way to track those cases. And recently, using other methods, there was about 476,000 confirmed cases of Lyme disease in the United States. Now we have all learned a little more about this crazy disease. It is silent, but could be very deadly. Always avoid tall, grassy, bushy areas when possible, and if you simply can't avoid it, check yourself for those little black ticks. It is also helpful to have a close friend, partner, or family member help check you as well, because let's face it, we can't see our whole body that easily. Thank you so much for your time. I do hope you can take this information and keep it with you for any future outdoor adventures. Goodbye, my friends, and if you have any questions, please let me know.